How do you handle a bee or wasp sting?
Welcome to Parenting Matters Now, a source of parenting advice a few minutes at a time.
Hi, this is Dr. Roger Smith with Parenting Matters Now. We see bee stings and wasp stings in the deep south. I assume that they're in other parts of the country as well, but there's always the panic when a child gets stung. One, because they're in pain, and so they're wanting comfort. But what do you do beyond that? And how do you think about this as a parent and in addressing the situations where there is some type of insect sting or bite or different things? And I want to say the number one thing you should be thinking about is cleanliness. And where you can, clean the area. If there's a stinger in there, try to brush it off. Try not to pinch it or squeeze it because, actually, if the stinger is still stuck in the skin, there's a little venom sac that's on the top of the stinger. And if you squeeze that, you actually can inject more venom, and it can be a larger effect. And so try to flick it off, scrape it off, do something where you don't actually pinch the stinger if it is stuck in. That doesn't happen very often, but it can. So be aware of that. Here is the kind of the summary statement of looking at stings. So a local reaction remains a local reaction. So what does that mean? If you see a child get stung on the hand and it's red and it's raised, it's tender, and you can see a line of redness, the panic is, oh, is this going to cause anaphylaxis? Are they going to have systemic effects? In general, you can say, if you see a local reaction, here remains a local reaction. Now, there is no absolutes, but this is generally true, that even a severe reaction, maybe the whole hand is swollen up, but that's a local reaction. Systemic reactions that concern us that would cause you to need to take some type of injection like an epinephrine shot. Those would cause breathing problems, wheezing, coughing, pallor, weakness, fainting, all those types of things that are systemic and not just where the sting was. If it happens that all the symptoms are where the sting is, that's a local reaction. And we should treat that just simply cool it, clean it, give Tylenol or ibuprofen or something that helps to reduce the pain. One of the biggest things that we can do as parents is comfort, providing the comfort and the calm. And so therefore we need to know that we can be calm. If it's a local reaction, you manage it like a local reaction. You don't have to have EpiPens in every drawer and in the glove compartment of your car for local reactions. So they do need, tenderness, care, and all of those things. But just remember, local reactions remain local reactions. Calm yourself, calm your own fears, because we imagine the worst. We picture the extreme. And have I seen the extreme? Yes, but in 40 years of medical practice, I've only seen a few. So it's not likely that it's your child. So calm yourself down and watch your child. If you can calm the child down and they're not fainting and pallor and their heart's not racing and they're not coughing and wheezing and having all kinds of respiratory types of symptoms, then you can simply provide comfort. And that is a good way. So that's a principle and parenting, is that we look at the real situation, not the imagined, and that we have to keep ourselves calm so that we can actually communicate and care for our children. So one, be informed, but two, recognize when your fears are unrealized, that it's simply a fear of what could happen, but it's not happening. And so as you approach bee stings, just know that if you see a bee in the grass, it's not the arch enemy. Your child will be fine. We'll say, on the other hand, if your child is prone to severe allergic reactions to other things, I would be very careful around any of the insect stings. So, because they could trigger the same type of reaction that your child has with other things. There's the balance. Take it all in, but in general, this world is largely a safe place. It's Dr. Roger Smith of Parenting Matters Now.
Subscribe to Parenting Matters Now for more advice, or go to rogersmithmd.com to search for more topics. See you next time.